Good evening. How are you all? I'm Dr. Aruna Vijay. So this is October, and so we always think about our breast health because this is the Breast Cancer Awareness Month. So it just reminds us all women to take care of our breast. So breast cancer is one of the most common cancer in women, and also it's one of the most preventative cancer. That means you can easily prevent by most screening methods and avoiding the risk factors. So first of all, what are all the risk factors that are associated with the breast cancer? So we can divide that into two. One is a genetic factor, other one is an environmental and the lifestyle risk factor. So what are the genetic factors? Being a woman is already a highest risk factor. That doesn't mean that men doesn't get it. They do get it, but the prevalence is very, very less. So men also do get breast cancer. So that's information I just want to give it out. And another genetic factor is if you have had anybody in your family, like your mother, your sister, your father's side, uncle, aunts, or your father himself or your children, if anyone had a breast cancer, then you are as an increased risk factor for that, increased chances. Then having personal history of breast cancer, that means you already had some kind of atypical cells in the breast tumors, or if you have had an insight to which we call like a 0 stage or a precancerous condition in your breast before, then you are at higher risk of getting a breast cancer. Then there is another genetic factor called a gene, BRCA gene it's called, BRCA, gene 1 and 2. So people in some family have this BRCA gene running in their family. So those people have more risk for developing a breast cancer and an ovarian cancer. So if anyone is diagnosed at a very younger age, less than 40, like we call it as a premenopausal age group, most of the time they undergo a genetic testing which is prevalent in almost every country now. So if you do that BRCA gene testing, then you could see your risk level for your breast cancer and an ovarian cancer, which is very useful. So you should know about your family tree. So the next genetic factor is the hormones we are taking. So if you have a genetic risk factor, then you should avoid most of the hormones. That's in the form of an oral contraception or a hormone replacement therapy after the menopause. Then another one based on the hormone is if you have had an early puberty before the age of 12, or if you have had a late menopause like after the age of 55, or you have never had conceived, you've never been pregnant, never had children of your own, or if you have had children over the age of conceived the first time over the age of 35, or if you have had trouble getting pregnant and had help through infertility treatments, then all these women are at a higher risk of getting breast cancer. So now going forward to the environmental or the health lifestyle changes that causes the risk factor is decreased physical activity, increased BMI, and in most communities now they started having parties and having more alcohol and being just taking more of these oral contraception in the form of IUDs. Also some of the hormones are infused in them, and these are all the environmental risk factors, I would say. So the most common thing is obesity. That's one of the common risk factor. And the other one I would say is like if at the younger age, which is very rare, had some kind of cancer in the head and neck or the chest and have had radiation for that, then you are at a greater risk of getting a breast cancer. So these are some of the risk factors, more important ones I have told. There are many other risk factors involved. So now we talked about what are your chances of getting a breast cancer. So what are all the methods to prevent getting a breast cancer? What you should do as a woman. So two things. Number one, you can do at home. You are going to examine your breast every month right after your periods between 3 and 5 days to check for any lumps, check for any changes in your breast skin, changes in your nipple, any discharge from the nipple, any lumps or tumors that you feel in your under your arm or over the breast. So you can do that by lying down, and for examining the right breast, use your left hand and feel with the flat of your fingers, not the tip of your fingers, and go in a certain circular motion, or go in a longitudinal way to examine and feel for anything. So do it on both breasts. And then second one is stand in front of the mirror. Look at your breast. If there is any swelling, any tumor, any skin changes, any redness, rashes, any puckering of the skin, any dimpling of the skin, all these are red flags that you should see a physician and get examined by them and proceed further with the investigations. So then when you're looking at the mirror, you can do it in 3 ways. One, with your arms on your side. So you're going to look at the difference in the size or the shape of the breast, or how it is deformed in some people or anything like that. Then you can have over your head and then watch on the side of the breast, the outer portion of the breast as far as you can, and you see any changes in your armpits, any visual lumps or any redness, the veins that are over the stuff. And then the next one is have your arms in your hip and hunch over and see if there is any retraction of the breast. When you're trying to bend over, it doesn't fall, but it gets more pulled to one side or anything like that. So watch for all these symptoms. This can be done at home. So if you see anything at home, when you're feeling a lump, or you see any redness or discharge, nipple discharge, anything other than a milky discharge is of concern. And milky discharge also, if you have a large amounts, then it's a red flag. You have to see a doctor. So these are all the things that you do at home. So who can do it? Every woman, once they attain puberty, they should be knowing how to do a breast examination. Like I said, it's very simple. You can teach your girls, the people. There are many videos and everything that be uploaded a lot of times, and then you can ask your doctor how to do it. Then you yourself can learn how to do it and teach you all the community people you know, all the women you know, your friends and your family, to do how you are. So you can do it right from the start of your puberty. Educate the girls, because younger girls also nowadays are getting breast cancer. Before they said it's only on the older women. Now we are seeing so many people even under the age of 30. I've seen many under the age of 30 with an aggressive breast cancer. When they are coming in the younger age group, less than 40 years, typically they are very aggressive. We call it triple negative. That means they're not hormone. So they are one of the aggressive forms of cancer. There are more different types of cancer. I'm not going to get into the details right now. So when it comes really in a younger age, it's very, very aggressive. So that's why we have to be aggressive in finding this so we can overcome this. So how frequent you have to do the breast self-exam? It should be done only once a month, right after your periods, from 3 to 5 days every month. Do not do it every single day. Do not get panicked doing it every week. It has to be done only once a month. And if you see any changes, go right away to your doctor. So if you are menopausal, then how do I do it? You do it at the same day. If you're doing a 1st of the month, October, then do it 1st of November. So keep a calendar and do it like that. So just do it once a month. If you see any changes, then what is the next thing you can do? If you see any changes, you're going to see your physician and they're going to do investigations. What are all the investigations available as a screening tool? Screening means you do not have any problems, but still you are going to have a test done as a mode of preventing the development of something. That's called screening. So we are going to do a screening mammogram. What is a mammogram? Mammogram really saves lives. Please do have a mammogram every year and you hit the age of 40. That's an average age every woman start. But if you have had a family history of a family member having a breast cancer at 40, then you're going to start 10 years earlier at the age of 30. So you're going to have it every year once. Even though you do not have any symptoms, just do it every year. That could of great help to you. So if you do not have a family history, just start it around the age of 40 and after that have it done every year or every other year. Now I think most of you have insurances and you can afford to do a health checkup. When you're going for a regular physical checkup, when you're doing the blood work for cholesterol or diabetes or anything like that, add this mammogram to that plate. All women, please do get a mammogram every year. Even if you're not at a high risk, because nowadays there are so many GMOs like we are eating. So all these foods, most of them have hormones. So the hormones are the culprit for a breast cancer. The breast cancer is fed by the hormones produced by the female organs. So most of the estrogen, progesterone and other hormones, that is why obesity plays a major role. It's one of the highest risk factor for getting a breast cancer because they produce a lot of estrogen. So who are all the high risk people getting that mammogram? They think that only people with a family history or had a cancer before have to get a mammogram. No, everyone has to get it. If you have a high risk personal breast cancer history or a family history of breast cancer, I would advise getting a mammogram and then in 6 months get an MRI and then get a mammogram and an MRI. So every 6 months you are getting a breast check through this diagnostic methods. Diagnostic imaging, you are getting every 6 months a breast check, which some of them you cannot find out by doing a breast self-exam. Because when you are feeling a tumor, that means it's at least a good amount of size. That cancer has grown to a nice size. Then only you can feel in your breast. So when they are really tiny, you cannot feel it. So this is where the diagnostic imaging, mammogram and an MRI of the breast or an ultrasound of the breast is going to help. So always please do remember this diagnostic imaging with the mammogram is really, really helpful for preventing breast cancer. Because there are two things you can see on a mammogram, a few things. So the most common we look for is calcifications, which are the calcium deficits and any masses, any distortions, we call as architectural distortions in the breast tissue. So these are all the three things, major things anyone looks on a mammogram for anyone. So what are the types of calcifications? It's called macrocalcification and a microcalcification. Macro means big, micro means small. Macrocalcification, not a big deal. It's probably calcified from an inflammation or an old scar or old milk duct clogged, like calcified, whatever. So it's not of major concern. But a microcalcification is a microscopic levels of calcifications. If they are in a certain look and pattern or suspicious for the radiologist, we know that how it looks, and then they're going to recommend a biopsy of that so that you can find if there is an earliest form of cancer. So microcalcification is one of the earliest detectable cancers, which probably a stage 0 or in situ or an atypical or a precancerous condition, which is highly preventable to growing into a big tumor. So when you detect something at that early stage, it's really, really 100% curable and also easy to treat. So that is why mammogram is the gold standard, because only the calcifications are seen only on a mammogram. It is not seen on an ultrasound of the breast. It is not seen on an MRI of the breast or anything else. So That is why the mammogram is still the gold standard in the diagnostic imaging of a breast cancer. That is why everyone wants every woman to get a mammogram every year over the age of 40. I understand some people are afraid of the radiation risk. You do not have to worry about it. When you take 2 pictures of the mammogram, at the most you're going to have 0.4 MSV of the radiation dosage. Normally in a year from your surroundings, which is called background radiation, we all live in the society, we get 3 to 4 MSVs. So getting a mammogram done in both breasts, probably like 6 to 7 weeks worth of background radiation you're going to get by living just in the world. So it's the same amount of radiation, so it's nothing more. So do not get afraid of being a radiation risk because you're getting it every year. This is a very, very low dose X-ray, and it's nothing of any concern because of the radiation accumulation or anything like that. So do get your mammogram every year. So nowadays there is a 3-dimensional mammograms. Before we used to do a 2D mammogram, now we do a 3D mammogram, which is called 3D tomosynthesis. So you get slices of your breast tissue. So it's more accurate, more resolution, which is helpful in seeing a teeny, very, very subtle architectural distortion of the breast tissue. The breast tissue is made up of fat and fibroglandular tissue. Glandular tissue is the one that produces milk. Fatty tissue is a supportive tissue. When you're young, your glandular tissue is more and your fatty tissue is less. So that is the reason sometimes the mammogram in a younger woman, younger than 40 years, is very, very, we call it dense mammogram. This is difficult to diagnose sometimes. But not all women less than age of 40 are having a dense breast, and then all the women having over the age of 40 are less dense. No, it all depends on the genetic factors, and then it all depends on your stature and your BMI. Everything accounts for it. So the distortion of the breast tissue is very nicely seen on these 3D images. And any tiny masses, I said, could be seen on this mammogram. So the calcification, the tiny masses, the tiny subtle architectural distortions are all seen very well on a mammogram. And then followed by an ultrasound, and if any question more, then you can do an MRI of the breast too. So if you're really at highest risk of getting a breast cancer, then you can get screening with an MRI and a mammogram alternatively every 6 months, and then doing self breast exam every single month, and having genetic testing positive, then you have a breast surgeon and having examined by a physician every year. So what are all the risks? We have talked about the risks. How to avoid those risks? So maintaining a healthy weight, healthy BMI, eating a healthy nutritious diet, and trying to stay away from all these hormones as much as possible, like oral contraception or hormone replacement therapy after the menopause, plays a much bigger role in preventing the breast cancer. So try to stay away from all these things to avoid getting a breast cancer. So now I think you got a little bit of I have shared my experiences and given you a little knowledge about what are the breast cancer risks, and what are the preventative and what are the diagnostic modalities that are available that you could use to prevent from getting a breast cancer. Hope you like this, and please, all women, go get a mammogram this October. Thank you. Have a nice day.